Welcome to Make America Healthy. My name is Beth Shaw. I'm the host of this podcast. I'm the founder of Yoga Fit Training Systems Worldwide, the leader in yoga, mind, body education. I'm the author of 4 best-selling books on health and wellness, and so happy that you've joined us here today. Our goal through Make America Healthy is to empower you, inspire you, and educate you so that you can make more informed choices as it comes to your physical and mental health. Because we want you to be your best you, to look at all the data, get all the information, then make your own choice, make your own educated choice. So we are just here to educate you. I'd also like to mention that any viewpoints expressed on this show have nothing to do with my work at YogaFit and are just that, opinions. So today's topic is the truth about menopause. It's a big topic because there are a lot of women in the US as well as around the world who are between the ages of 40 and 60 who are suffering from that dreaded thing called perimenopause, menopause, and of course, all the PMS that comes before it. We're joined today by our repeat guest, Dr. Habib, and he's got a passion to rethink health and wellness. He has coined the term rethink medicine. He has his own clinic called Next Health, and he is a medical doctor. He studied in England, and he's got amazing credentials, and we welcome him back. We are also joined with Marie Hoag, who is a clinical hormone coach of over 20 years, the founder of Menopause, Moxie.com, and she specializes in advanced female hormone balancing, menstrual cycle preservation, as if you want to preserve that, I think we might find out you do, and restoration, and a perimenopause and menopause prevention and reversal expert. Welcome to Make America Healthy. Menopause is a big deal, I have a lot of friends that it's a big deal for. I have friends that have gone through menopause at age 39. I have colleagues in Japan who say it's one of Japan's number one problems. And it's probably a thing that doesn't get talked about enough. The information, when you start to look it up and Googling it, you get a whole bunch of different information. And I think a lot of women don't really know where to go and what the right information is for them. Dr. Habib, as a doctor, can you explain your definition of menopause to our listeners?
Well, thank you for inviting me, and I look forward to having an engaging conversation with Marie, get her perspective, and hopefully we learn something new here. Just to reiterate, I know my name is not there, so I'm a medical doctor. I'm in the Washington, D.C. area. And as you said, I graduated from England, but I have done my residency in Tufts University and have about 30 years of experience. And I focus mostly on functional medicine, which has led me to longevity medicine. But in order to achieve longevity, you have to understand what drives disease. So I'm kind of, by no choice, I have to be an expert at preventing disease. And the same mechanisms that create disease also makes people prematurely age. And what we're going to hopefully discuss is staying biologically young on the reproductive side. So when you mentioned what is the definition, I would say that it really depends on family history as to when female members reach the menopausal years, and it can vary between mid-40s to mid-50s, but Marie can add a little bit more detail to that. So I go by the family history. So if it's within that range of family, but as you brought up, it could be premature early. So what's going on there? If there's a premature failure, nowadays we talk about the mitochondrial level. So hopefully we can get into the mitochondrial side a little bit. And I think a lot of the problems that people have is once they get to what they think is menopause, where their periods become irregular, less frequent, and then they get to the stage where it's post-menopause. Those symptoms that come with it, I think, is what we're going to discuss. And the question is, how long is acceptable and how long is not acceptable? So the range is between 45 and 55, and it just depends on the family history and then the symptoms and how long the symptoms go on for.
Wonderful. And Marie, I am going to ask you the same question.
What's my definition of menopause?
Yeah.
I know that most people look at menopause as a condition that women have to endure, but I don't look at it that way because my personal experience and professional experience working in a hormone clinic for over 20 years, working directly with patients, taking all forms of HRT, I have come to look at menopause as just another side effect of estrogen deficiency. Just like depression, anxiety, insomnia, menopause is the cessation of the periods, menses, The meno is the menses, and the pause is the cessation of the having periods. It's the anniversary of 1 year of not having periods. So my approach, what I've seen is that if you restore estrogen and progesterone in women, that a woman can choose when or if she ever experiences this cessation of her period. When menopause is approached as a condition that needs to be managed, or postmenopause, it needs to be conditioned that managed, well, that's what ends up happening. But if it's approached as a hormone deficiency disease, then you can restore a healthy, incident-free, regular menstrual cycle for women, whether they have a uterus or not. And that's what I did as a patient, and coach women, thousands of women actually, over the past couple of decades, to restore hormones in a way that allows them to maintain a healthy and regular menstrual cycle until they choose not to, which is usually somewhere in a woman's late 70s is usually when women stop wanting to have periods, because of the benefits that come with having those hormones.
It's so interesting because I have a friend who went through menopause at age 39. And then I also have one of my health and business coaching clients who went through menopause. She's 60, but her doctors refuse to test her hormones because they say, well, they're just going to be low. I'll put those two scenarios out to both of you. Then a lot of our listeners posted questions on social media that I want to ask you as well. So if either one of you want to jump in as to why someone would go through menopause, Marie, why don't you take that one? Why does someone go through menopause at 39? And then also, why won't someone test someone's hormones who's 60 and has already gone through menopause?
We've seen trends over the past couple of decades in hormone medicine. And when women go to the hormone doctor for their hormonal imbalances, the latest, as I may have mentioned before in a previous conversation, I'm getting women in their late 20s complaining about perimenopausal symptoms. And women that are younger, I know the average age, everybody talks about the average age of menopause being around 51, but women who have children in their mid-30s tend to not bounce back after their pregnancies with regards to restoring estrogen and progesterone that allow for a healthy, incident-free menstrual cycle. And these women tend to go into menopause more quickly. So we're seeing these ages of women going into menopause younger and younger. So what I've noticed over the years now is especially the past 2 generations, due to the transgenerational inheritance of ovarian dysfunction, which is my latest field of research, is these young women are not producing healthy levels of estrogen and progesterone to ever create this healthy menstrual cycle through puberty.
Can
They
I
don't make it.
stop you just for 1 second?
Sure.
Years ago, they said that women in certain countries in particular were getting their periods earlier because of the hormone pumped up chicken. We heard that, but now I'm hearing women, are going into menopause earlier also. Does this have anything to do with all the hormones that are injected into our food sources?
Yeah, there are several things that can shut the ovaries down, the signaling to the ovaries or the ovarian health itself. But whatever influences the body's ability to produce estrogen and progesterone will affect the menstrual cycle. And so that's why you see around the world, it depends on a person's diet. Processed food is an endocrine disrupting chemical. Even protein powders are highly processed food. A lot of people are married to protein powders and protein shakes, but we found that creates a lot of gut dysbiosis, especially patients that are trying to clean up their gut health.
Especially whey protein. I have found I stopped with the whey protein. Now, actually, I'm drinking plant-based because I took a food sensitivity test. Not every day, of course, but I'm finding that the plant-based proteins are a lot easier on my digestive system and probably easier on my microbiome.
And not only that, but we had mentioned before in a previous conversation that we're about 4 or 5 generations deep with ovarian dysfunction. Women with broken ovaries do not give birth to children with healthy ovaries or healthy testes. It's one of the reasons we see these young women not really having a healthy menstrual cycle. They're put on birth control pills and antidepressants at a young age. It shuts their ovaries down. By the time women come to see me in their mid to late 30s, they've never had a healthy period. They don't know what that's like to feel that. So when they get estrogen and progesterone at the doses where their body functions best, they're like, what is this? I've never had this. And that was me. I was put on birth control pills and antidepressants at a very young age. I was told I was severely clinically depressed with a list of different diagnoses, mental illness diagnoses, and lived that life for a long time until I met a doctor who says, honey, you don't have a Prozac deficiency, you have estrogen deficiency.
Thank you so much for sharing that, because my fear in hearing anyone, especially women, put on antidepressants is no one's checking their hormone levels. And they were just giving them a happy pill, which, you know what? Happy pills have their place. Don't get me wrong. I've been on and off of antidepressants for a lot of my life. Currently not on them and trying to stay off them through natural modalities. Ladies listening to this show, do your research. If you're on antidepressants, if you're depressed, if you've been prescribed stuff, have your hormones checked. Dr. Habib, how do you weigh in on this? Women getting their period cessation early, women in their late 50s, early 60s, and their doctors won't test their hormones because they say, well, they're going to be low anyway. Tell me, if those ladies came into your office, what would you do?
Right. I like the word happy there. I heard that somewhere. So I'm going to throw in some dopamine at you in a minute. So I'm going to try to connect the brain and the body for you to try to keep it a little bit on the simple side. I think people don't come in with a diagnosis, right? People come in usually with symptoms. They'll go to the practitioner and say, you know what, I have a bit of a brain fog, or maybe my mind is not very clear. When I wake up, I don't have the energy, or I'm gaining weight and my joints may be stiff and the skin may not be looking as healthy or the elastic. So I think people have symptoms and we need to kind of figure out what the differential diagnosis is. And I think that we can definitely incorporate the hormonal side. And so you brought up that they're premenopausal, yet they have symptoms. I would classify them as a dysfunction, right? Dysregulation. They have hormones, and oftentimes for people who are premenopausal and they have a constellation of symptoms, it's more to do with an imbalance. As you were saying, measuring is one thing, but interfering with the hormones is more about dysregulation. It can happen in the body because of insulin resistance and inflammation and toxicity. It can also happen in the brain because the brain is where all hormones originate, between the hypothalamus and the pituitary. So direct stress, and that can be from emotional stress, that can be from volitional, like not sleeping adequately, head injury, and neurotoxins that have a propensity. So I think when people have hormones and things are not going well, it's more about dysregulation. Something is interfering with their normal function. And generally, people who are premenopausal get away with a lot. I like to think so because all the numbers are great. Cholesterol is great, blood pressure is great, blood sugar is great. They feel great for the most part, except for the ones who have dysregulation. But even those people may have underlying symptoms that are being masked, and they present after menopause, when the luxury of the hormones are gone. And we can debate about giving the hormone replacement versus looking for what's going on, is that maybe the symptoms were already there, blood pressure problems or sugars that weren't quite ideal, but they were perfectly normal pre-menopause, but post-menopause, they seem to have appeared. And we've always said, oh, that's because you're just post-menopausal. But maybe they were already there because there were underlying processes like, as I said, insulin resistance, inflammation, toxicity, immune dysregulation. And they're at the mitochondrial level, actually. So now just moving into the premature ovarian function or dysfunction or failure, that's definitely mitochondrial, right? All these hormones that we talk about, they can't happen without energy. And so when we talk about progesterone being produced, well, yeah, it's the ovaries, but it's coming from within the mitochondria in the ovaries. When we talk about cortisol, which is something we should actually discuss amongst other hormones. So hormones, you can't just isolate sex hormones. They're in context with the insulin hormone and the thyroid hormone. And so you have to think of all these in harmony, and they do interact. And so I think in the people that have premature ovarian failure, where they're trying to get conceived, and the fertility doctor says, oh, you hardly have any eggs, this is a problem. And so the mitochondria is affected by the same things: inflammation, insulin resistance, toxicity, immune dysregulation, because the mitochondria is involved in the hormone production. Like cortisol is made in the mitochondria in the adrenal glands. So I think that we have to look at the entirety. When someone comes to us, they don't come with a diagnosis, they come with symptoms. We look at what's the possibilities of those based on their age. And yeah, go ahead.
We have a question from one of our listeners who just wrote in, if I freeze my eggs and then I go through menopause, can I still get pregnant?
And after you, Marie, I was waiting for you.
Oh, no, you need estrogen and progesterone to maintain that pregnancy.
Okay, so the answer is if you freeze your eggs and go through menopause, no, you cannot get
Well,
pregnant.
I'm not a physician, so maybe the physician should ask this, but I believe that women need plenty of estrogen and progesterone to be able to create a baby. And if you don't have that, the baby's not going to survive. But the doctor can tell you in more scientific detail why that's the case.
Yeah, well, I mean, thanks, Maria. And, I think, and I'll defer, but I'll give you my opinion because I'm not a fertility doctor, but I've had many people who have been trying to conceive. Some people can't conceive, and there are others who conceive, but they lose their baby. They can't carry them. And I had one female who was the wife of one of my employees who did my social media, and they were well-to-do. They made both of them had income, and they were looking all around the world for the answer because they would carry the baby and lose it within the first trimester, not twice, not three times, even a fourth time. So I told them, look, the elephant in the room is insulin resistance. All bets are off. Just take care of that first and then see what happens. And lo and behold, when they took that to heart, they got pregnant for the fifth time and they have a nice, healthy baby called Adam. So I would say that I think it's important to stay healthy is the way.
Thank you. Someone else had a question. We encourage our listeners to post their social media questions on our Make America Healthy social media. What are the benefits, Marie, I'm going to have you answer this. What are the benefits of keeping your period later in life?
When we were trying to figure out what that optimal hormonal balance is, when women have enough hormones, like Dr. Habib said, when patients come in, they're coming in with symptoms, and you have to figure out what's causing those symptoms. And what we found is the majority of the mental illness and physical symptoms and the dysfunctional processes of the body are directly related to main sex hormone deficiency. In fact, main sex hormone estrogen deficiency, estrogen itself regulates insulin. So when you talk about insulin and insulin resistance, you really can't address insulin resistance without addressing estrogen. And I think, I'm sorry, I think I went off on a different, what was your question?
The question is, what are the benefits? And I have this question too, because I have not gone through menopause. I'm in my 50s. It doesn't show any signs of going away. I get horrible PMS every month. I have literally different personality. The food cravings, I'm hitting up the candy bars. This question is not for me, but if I was to ask a question, this would be from me. What are the benefits of keeping your period like into your 60s?
The thing in functional medicine training, and even at the A4M or even I4M, there's no real clinical destination with hormone therapy. The doctors don't say, okay, when your patient achieves these levels, this is what's going to happen. So we had to figure it out. And that's when I mentioned to you before that when you restore hormones in women in a very methodical manner, the body responds. The brain and body responds to those hormones. And as you are addressing the clinical indicators with the hormone replacement therapy and the brain is starting to work better, the body wants to be healthier. And so if you're giving a woman hormones that mimic somebody in their reproductive prime, say in their early 30s, well, then the body wants to replicate that. And part of what happens is the body tries to function in a healthier way. The digestion works better. The menstrual cycle comes back. The more you optimize estrogen and progesterone for women, the better they feel mentally and physically. But the side effect of that is as your body is healing itself, the body starts to menstruate again because the brain is under the impression the woman is not dying off and in a state of survival, that she's actually in her reproductive prime. So as long as I maintain a healthy menstrual cycle for myself, I don't have mental illness. I'm not on medications. I don't have high blood pressure. I don't have insulin resistance. I don't have low energy. I don't have a low libido. In fact, I'm not on any medications. But when I get off of estrogen and progesterone, or estrogen mostly, I have a handful of mental illnesses. But the period is really just, the menstrual cycle is really just a mere inconvenience of optimal health. But there is a destination for that. And that's when we found out, okay, women do their best here because we measure the clinical indicators. And their lab work is right here. But if we give a woman more hormones than this, then she feels worse. If we give her less, she feels worse. So this is the sweet spot. And that sweet spot comes with the
Let's talk about hormone replacement. I am on some hormone replacement, and it involves basically testosterone and progesterone. Marie, I know that you have a viewpoint of giving women a healthy dose of estrogen. I also know that there were studies done, 20 years ago or so, that showed that giving women excess estrogen is not perhaps the best course of action. So I'd like you both to talk about your personal professional viewpoints on HRT and what you think might be the best course of action in general, not specifically, but in general for women. And you may disagree, and that's okay.
Ladies first.
So I've been on every form of HRT with the exception of pellet therapy because I think it's terribly barbaric. You can't replicate a healthy menstrual cycle with pellet therapy. You can't match the physiology of a hormone with pellet therapy. Why I'm so confident with what I know is because I've worked with these hormones, not just taken them myself and measuring my clinical indicators, but measuring blood work once every 4 months on every patient with clinical indicators. You get some pretty good data over the years on what works and what doesn't work when they stop working. Low dose therapies tend to stop working in about 3 to 9 months, depending on the patient's overall gut health.
And let's quantify low dose, meaning like creams and patches, right?
Yes, low dose, therapy that's designed to keep hormones low.
Okay.
And then the goal is to manage the symptoms of hormone deficiencies that still exist. And this is what they teach at IFM and A4M. Start low, go slow. But that's the extent of the education. When you go back to ask questions about, okay, so this stopped working, what do I do now? My patient's on the maximum patch dose. It doesn't work anymore. What do I do? Oh, well, now you have medications and supplements and treatments and other rabbit holes to go down to keep the patient occupied. But if you fully restore the hormones with a rhythmic protocol, then you don't have these symptoms. So the goal really is to restore the hormones so that the symptoms don't exist. And there is a thing, but there's only a handful of places in the country that teach doctors how to fully restore hormones in a rhythmic pattern. So there are rhythmic protocols, like I mentioned, about, changing the dose every day to match that hormone physiology. But there's also easier and better ways, like, say, a weekly injection. Right now, my HRT system is a weekly injection and progesterone 14 days on, 14 days off. And this gives my body a regular menstrual cycle. I can feel my body cycle, even though I don't have a period because I don't have a uterus, but I still have a menstrual cycle, my brain and body cycle every month. And as long as
are you still getting PMS?
Oh, no, that's one of the symptoms of estrogen deficiency.
Okay.
So this, when I teach physicians how to prescribe hormones, we use these markers. It's part of the clinical indicator assessment we monitor on every patient the morning of every blood draw. So you always know where a patient stands. It's more than just, you can't just go by where the hormone levels are, because you can get estrogen in the 300 range for women and they'll feel like crap. So you have to ask, why is this? Well, there's a handful of different reasons why that is, but eventually stops happening. Women will they'll get better and better and better until there's a point where they can't imagine feeling any better than they do. And then you see that these ranges are the same. So when a woman finally stopped begging for more estrogen, their labs are in a certain range. So why would we keep those levels low for other women? That's how we figured out, where is that hormone sweet spot? Where is that place of hormonal balance that everybody talks about? Most people don't have a clinical destination for balance.
So individual from woman to woman.
I know everybody likes that. That's what they teach at IFM and the bioindividuality and that sort of thing. But there's only so many different ways that you can give a woman hormones and so many levels that you can get. And then we found that there's just a technique and a process that you start low, go slow. But there is a titration adaptation process that takes place over several cycles as the body adapts to those dosing adjustments. Then there's just this place where women cannot imagine feeling better. They no longer have type 2 diabetes. They no longer have high blood pressure, high cholesterol, insulin resistance, fibromyalgia, depression, mood swings, PMS. So if a patient has PMS, in my opinion, their hormones they don't have enough. Usually it's related to estrogen. And that's where we look and we adjust the hormones until the symptoms are gone.
Great. Thank you. Dr. Habib, please let us know what you think about hormone replacement therapy, pellet therapy. One of our listeners wrote in and asked, are there natural ways for me to increase my hormone levels, or is some form of HRT my only option?
There's a lot of complicated and individualized presentation. Being a doctor, there's got to be a systematic approach to everything. And so before we can talk about a treatment, you have to have the right diagnosis. And so when I have anybody with any symptoms, I try to look at what are the common things that impact symptoms. As I said, you start from the top and work down with the sleep and the cognition, the mental focus and the energy, the joints, things like that. So you start with the symptoms, and then you want to look at what kind of physical possibilities could be interfering with the hormones or affecting even the mitochondria. And then beyond that, I'm going to touch base on the brain, because that's a very exciting area right now, which I think has been overlooked. So when it comes to the therapy, I think the bioidenticals tend to be more targeted because you have estrogen receptors all over your body. That's why when people are premenopausal, their brain works better, the skin is better, the cholesterol, the insulin sensitivity, the bones are stronger. But there are two types of receptors, the alpha and the beta receptors. So when you're young, you rely on the alpha receptors for proliferation and growth, for breast tissues and other female sexual functions. And so that is appropriate. And I think that as you get older, you have to be careful of not overdoing the alpha. And that's where the bioidentical hormone comes in. You can control the beta aspect with beta formulations and less of the alpha, because you don't want as much alpha as you get older. So people who do this routinely, I don't do this daily. I tend to focus on trying to look at the environment of why people feel dysregulated when they're premenopausal and why their postmenopausal symptoms are so prolonged. And I generally find things that interfere with the hormones at both levels. Now, on the brain part, most of the hormones start, whether it's the thyroid releasing hormone or even insulin, but the cortisol, the sex hormones, they start in the hypothalamus, and then through the pituitary, the signals then go down to the rest of the body, your thyroid, your adrenal glands. Now, that's why it's important when you look at, if you're going to assess the hormones, you must assess the complete hormones, assess the thyroid function, assess the adrenal function, the morning cortisol awakening response, what is the cortisol in the middle of the day, afternoon, early evening, because they may tell a bigger story. Of where the signals are coming from. Is the signals coming from the brain the problem, or is the organ itself that's being affected? The thyroid organ start producing the thyroid, or the pancreas is not doing it, or the cortisol is not doing it, or the adrenal gland's not doing it. Because now what's exciting is that we're because of these GLPs and all these things about what happens in the gut and then what happens in the brain, we're now even to the point where you have the vasomotor symptoms from postmenopausal women. Instead of giving hormone replacement, they're using a peptide to block what's called a neurokinin. It's to block a peptide which stops the postmenopausal symptoms of what we call vasovagal. That's the hot flashes and sweats, things like that. And I'm not an advocate of it. I'm just saying that when they have these products, there's a lot of research. So we can use
that pill they've been advertising on TV. Yep. I mean, but that pill, like so many other pills, has like 10 side effects.
Exactly. I'm not.
You have to choose between like hot flashes and diarrhea, constipation.
And it doesn't address the root cause of estrogen deficiency. You restore estrogen, that goes away. Now you're not chasing symptoms with something, and you get all the benefits of restoring estrogen, because when women have hot flashes, they have a lot of other things too. So it's like.
Yeah, I was going to say, I haven't finished though. Sorry, I had to interrupt. Because I'm not advocating any of those prescriptions. What I'm saying is that if you understand the mechanism, now we have information, data of connecting the dots. That's why I go back to, you have to look for this inflammation. You've got to look for the insulin resistance. You've got to look for the toxicity, because that's where the gut's involved. And they interfere with these peptides. That's why drug companies have made these products, because something has damaged them. So they come in sly way and say, oh, you don't need to worry about changing anything. Just take one of these. So I'm just trying to give you the brain connection that what's going on is that people are low on their dopamine. And as a result, the inhibition, that means the dopamine has a way to hold back prolactin. And increasingly, people are having higher prolactin levels, which is part of the dysregulation. High prolactin gives male people symptoms of low sex drive and low testosterone. And in women, they're having hormonal problems. And it's because of stress, and it's because of all the other things that use up the hormone. And by the way, when the dopamine is replaced in the brain, blood sugars come down. And this is proven because there's another drug that is, and I'm not a drug pusher, I'm just telling you that's where the data is, right? Nobody has data like companies that spend billions of dollars. I don't have data. I learned from people with data. So what we're saying is that dopamine was increased. And what they found is that it blunted the sympathetic drive. The stress response is the sympathetic drive. And the dopamine had a beneficial effect on minimizing sympathetic drive. So cortisol came down, epinephrine came down, and blood sugars came down. So what I'm trying to open people's idea is that we have the body part, which find out things that could potentially interfere. If not, then you can move to your therapy. But I would say also think about the brain part before you move to therapy to find out if there's an imbalance there. So whether it's stress or neurotoxins or some kind of lack of sleep even, that they're all interconnected between the brain and the body, and that includes the gut and the hormones and everything in between.
That's a very typical functional medicine approach. It's not as complicated as that. And everything that you have mentioned is influenced by estrogen, but functional medicine doesn't talk about restoring estrogen. Estrogen influences dopamine, serotonin. It influences absolutely everything. And so, yeah, you can look in the brain and see if there's a misfiring or if there's something going on, but the reality is the patient's still estrogen deficient. And so if you continue to go, you, meaning functional medicine physicians, continue to go down this rabbit hole and this rabbit hole, offer this peptide, offer this drug, offer this supplement to treat the symptoms that really wouldn't exist if estrogen were fully restored. Now you can take a look to see. And that's been my frustration with functional medicine. I've had that training. We've gone down those rabbit holes. And then when I stood back in the clinic looking, this is just a business model. So now I'm making money off of tests and selling supplements and everything. Well, these conditions don't exist and these symptoms don't exist if we can just get estrogen and progesterone to optimal levels. And if there's anything left over, then we know we have a real true condition here that's not associated with hormone deficiency. And so that's been my big frustration when I said, no more of this rabbit hole functional medicine mindset. Because of the data that's been collected over the years, we see that women don't have these issues, dopamine issues or mood issues or insulin issues or gut issues for that matter, when they have enough estrogen. And that's been my frustration with functional medicine, to the point where I just said, you know what? Yeah, there's some good foundational education with functional medicine, but this business model that they've set up for physicians is nothing but an exercise wheel of chasing the symptoms of main sex hormone deficiencies for women, leaving women hormonally deficient and miserable, and now spending thousands of dollars of money off things that aren't truly addressing the root cause. So I think functional medicine has a real issue with lying to doctors about getting to the root cause, that they're actually going to be able to fix it, when it's just nothing but symptoms management. And it didn't work for me, and it doesn't work for other women, especially when you see for yourself. And if there was any message that I would give to any physician, especially functional medicine, it's like, you have the foundational training, but take a look for yourself what happens if you fully restore estrogen and progesterone. Then step back and take a look at the big picture. Now let's have a conversation, because it's completely different. And that's what I encourage as physicians, just learn about estrogen, because they don't teach it in functional. They teach still, it's just keep it low, go slow, keep it low. Estrogen causes cancer. It can't get too high. But if you had the same experience I did with the witnessing of what happens to women who have plenty of estrogen, we'd have a different podcast, because you would see for yourself, oh, well, this doesn't exist in my patient who maintains estrogen in the 350 to 550 range. It took me I'm like, why are we doing this? If we can just give women estrogen, there's no reason to do this. This actually changes our business model now as a clinic. And then that's what I had to do, because I didn't feel like we were properly serving women.
Marie, you and I have spoken on several occasions, and I know that you have a very specific approach that seems to me to be pretty scientific and sense.
Yeah, stumbled upon clinically when you pay attention to estrogen.
I went to my functional medicine doctor and I said, I want to raise my estrogen levels to between, I think you said between 300 and 700. And he's like, there's no way I would do that.
No,
the testosterone that I'm giving you would convert to estrogen anyway. And he said, there's no way that I would ever do that, because there are certain cancers that are linked to estrogen-specific cancers.
That is the general mindset. Even functional medicine that comes at a more natural approach than conventional medicine, there's still an underlying fear that estrogen causes cancer.
And where does that fear come from, please?
Oh, years. The pharmaceutical industry. as long as we can keep the medical establishment can keep women estrogen deficient, there are a lot of mental illness diagnoses that can be medications to be prescribed for. It's just, and had I not seen this with my own eyes or experienced it, I was one appointment away from shock therapy. I was told at 17, I was severely clinically depressed, put on birth control pills and antidepressants most of my life. And at 30, just about 35, 2 babies under 3, I was told I'm out of drug cocktails. And if I wanted to fix my mental illness, all my diagnoses, I would need shock therapy. And it wasn't until I got some estrogen for the very first time of my life, I felt alive and happy for no real good reason. And I no longer in the medications, I got off the medications because those conditions didn't exist. And why would you go back to reducing your estrogen if you no longer have those symptoms? And so when you have plenty of estrogen, so I get really passionate about it because I listened to these doctors who told me they were going to help me. And so when you see this, when it happened to me, and then I started witnessing in the clinic, and that's when I got really heated. I'm like, okay, we even got functional medicine training. I mean, it's like,
so how is it that you had a clinic that was courageous enough to do something that went against the traditional viewpoints and thoughts on estrogen replacement therapy now?
Well, I'll tell you how, because we discovered the Wiley protocol and then we discovered the flaws of it and then made it better. And when you actually see a protocol that works, you can step back, because like I said, I monitor 50 clinical indicators once every 4 months and measure them against lab work on the morning of a patient's blood draw. So anytime there's a dosing adjustment that's made, a diet change, anything, we see it in the clinical indicators. And luckily, I worked with a group of doctors who we kept getting calls. Do you do the Wiley protocol? Wiley protocol? No, we don't. What is that? So we called Wiley. Hey, what's this protocol? And we learned about the protocol. Then it's like, holy cow. Well, this is different. This is interesting. The closer we get hormones to a certain, if we can establish this healthy menstrual cycle, get hormones up and regulate this menstrual cycle, then there appears to be a reversal in the brain and body. But then we found some clinical flaws to the Wiley protocol and approached Wiley with it and said, listen, we've been able to navigate around these. So now instead of this protocol working on 20 of our patients, if you make these adjustments, it'll work on 80% of the patients. But she wasn't interested. And so there are a handful of doctors across the country who have come across these clinical flaws with the Wiley protocol who've developed their own, but it involves restoring hormones enough that allows women to have their brain back. And there is no more mental illness or physical decline. Well, there's always gut issues if there's a poor diet, but estrogen has such a powerful role in gut health that there's a point where patients need to bring that on when they're trying to change the healthy ecology of their gut microbiome. When you see for yourself what happens over and over and you're measuring clinical, the data that I have is just crazy.
And is this anything you could find on the NIH?
No. When I saw this in the clinic, I was like, what the hell? I was like, what? Why aren't doctors doing this? And so I started to dig around and I started asking questions when I go to the A4M conferences every year. And I'd ask doctors, what are you doing? Is it working? This is how I know what other doctors are doing. And then working in the clinic, it's like, where do we get this information? Has anybody else seen this from a clinical perspective? Well, these Wiley doctors did to a degree, but some aren't courageous. And like I mentioned before, we live in the county where we have the highest breast cancer incident rate than any other county in California. And so we should have a higher breast cancer incident rate than anybody because all we do are high dose hormone therapies. And that hasn't been the case. And with the data that I've collected over the years, I've been able to see, well, most women don't have these diseases that we all talk about. And that's what had me start my research foundation, because
is all of this research available on your website, Marie?
No, the research through Panacea Sciences is my research foundation, but we are getting funding for studies.
If our listeners want to use Dr. Google, they're not going to get very far.
No, because you can't even find studies in the National Library of Medicine when a patient maintains estrogen in the 350 to 550 range.
Great. I'm gonna jump in here and ask, because we're quickly running out of time. Dr. Habib, please give me your thoughts on.
Yeah, because one of your viewers actually asked the question, can I do this naturally? So let's see if I can incorporate that in our conversation. The first point I'd say is people who are premenopausal, they have plenty of hormones and they still have problems. So I would say that I would encourage people to understand that the human body wasn't designed to fall apart. And for majority of situations, we have things produced like stem cells and things that are recycled and metabolized. That's your body has this constant cycle of production, recycling. We can repair things, we can put things to sleep, we can destroy things. And so your body is very acclimatized to doing this, whether it's your red cells, your immune cells, your lining in your gut or your skin or your hair, and also hormones. And so I have nothing against giving hormones. I'm just saying you have to be a little bit, before you start giving any treatment, you have to know what the problems are. And it's never one thing. In my experience, it's never one. Like most doctors will have a condition in front of them and say, oh, I've made a diagnosis. And you may have made that diagnosis at that moment in time, but you didn't go back 5 or 10 years and look at all the processes that led to that diagnosis. And so I would say that more things interfere with the normal functioning than actually people being born one way or they end up this way or everybody should be on it. And it's an epidemic when we talk about inflammation, whether it's the 18-year-old, the 28-year-old, the 38-year-old, and they will disrupt the hormones. And when you have heavy metals and toxins, they interfere with the way the liver can bind things and make them water soluble. We call them conjugation. And then even the microbiome is involved in the breakdown and the elimination. So if things are, so you give lots of hormones, I have nothing against it, but you've got to make sure that you look at the entire metabolism, that you've taken it in, now your body's going to break it down. It's going to process it. So if you have methylation defects, if you have problems where you have gut dysbiosis, you're going to get toxins that are going to be reintroduced back into the enterohepatic pathway. So I think that, again, that's why I always start with evaluation, including a hormone evaluation. It's not that I don't do hormone evaluations, but before I do any treatment, I want to know what's the problem. And as I said, most doctors, whether it's functional doctors, and I'm sorry, Maria dealt with a functional doctor like that, but any doctor, if you're too quick to give treatment, then you're not going to look at the big picture. You've got to look at what are you dealing with to begin with. And I'm not against hormone therapy. When you give it in the right balance and you monitor it, and just understand that it's going to be metabolized and it's got a cycle. So there are ways to do it naturally. Naturally would be eliminate anything that interferes with it and then see where you stand. And if your levels are low, that it's one consideration.
As we move towards the close of the show, someone else wrote in they're suffering from muffin top, belly bloat, fatigue, and brain fog. I've always been very open to making myself a guinea pig. Marie, I told you the other day I'd be happy to try this high estrogen protocol, although you did tell me I would gain weight, and I don't quite know how I feel about that. I'm open to experimenting on myself with a variety of things. I have done it with microdose psychedelics. I've done it with supplements throughout the years. It's part of my job and part of my curiosity and part of my personality. But for those of our listeners who are a little less experimental and want to know a course of action, it seems like there is not a clear-cut one. Give our listeners a few parting words of wisdom so that they can enjoy greater health, better mental health for sure, less PMS, and perhaps no muffin top, belly bloat, fatigue, and brain fog.
Yeah, those symptoms we take care of with restoring estrogen. And we do go down and look to see what causes these things. But after years and years of doing that, and the message keeps pointing back to that the hormones are low, women will get fat. And you in particular, your particular situation, you will gain weight when you start. But for the most part, women lose weight. Estrogen sculpts the body and it makes the body more feminine. So if women are interested in losing weight, getting to the root of the depression, I would have to say 85 to 90% of mental illness diagnosis is directly related to estrogen deficiency. So if you want to find out truly if you have a true mental illness, restore your estrogen first and see if there's anything going on. But estrogen, in my opinion, I cannot imagine life without it. It's the happiness hormone that allows a woman to be happy and contented and at peace every day consistently without any sort of triggers. And to live a life so poorly that I had to have shock therapy, that's how bad it was. And to get estrogen and to not be on anything and to not have a mental illness, just speaks volumes. It's just nice to not have to think about death every day.
Well, thank you. Thank you so much for your honesty, Marie. And we really appreciate your share, your authenticity, your passion, and your viewpoint. Dr. Habib, any final words of wisdom for our
Yeah.
listeners?
Yep. As a medical doctor, I have to deal with everything, whether it's heart attacks, which is the most common ailment for a woman, and then cancer and fatty liver. So you see all this. So there's never one cause for anything, and there will never be one treatment for everything. But what comes up over and over in all the evaluations, not for every patient, but variations. Before you embark on any treatment, make sure that your doctor excludes insulin resistance, inflammation, immune dysregulation, toxicity. If I gave you one final advice that it doesn't have to be complicated, I totally agree. And instead of going on a merry-go-round of different therapies, if you don't have those initial abnormalities and you focus on optimizing the liver's ability to detox, you'll find that most things are regulated just perfectly, whether it's carbohydrate metabolism, protein metabolism, lipid metabolism, hormonal metabolism. It's all down to the liver. And we don't need to go down to the genetic SNPs and so forth. You ask for simplicity, eliminate the big disruptors of everything, of A to Z for men and women, and then optimize the liver's ability to help you stay regulated and balanced.
Wonderful. I'd like to thank you both so much for sharing your expertise and knowledge. If you enjoyed this show and you know someone who needs to hear it, please share it. This is a good one. We'd like to thank our sponsors, Life Boost Coffee, making clean, organic, pesticide, and mold-free coffee that's shade-grown, and they pay their farmers an equitable wage. They have over 50 different varieties of coffee, including the new mindfulness blend that I created that's half calf, dark roast, and will get you energized without getting you too jacked up. So go to lifeboostcoffee.com and save 15% at checkout by using the code YogaFit15. We'd also like to thank our sponsor, Zirconia Lasers, making high-level red light and blue light lasers. The lasers are good for pain, for inflammation, for scar tissue. You can use them on your pets. I use one on my dog. You can use them for horses and cats. They have all different types of settings, including infection settings and gingivitis. So if you're a professional health practitioner, a vet tech, or you just want to improve your health with red light laser therapy, check out zirconialasers.com. We'd also like to thank our title sponsor, YogaFit Training Systems Worldwide, the leader in yoga, mind, body, fitness education, for over 26 years, offering conferences, online trainings, virtual trainings, events, retreats, and so much more. We're opening up a new Be Yoga Fit studio in Fort Lauderdale, Florida in May of 2024, and we'll be having lots of trainings there. You can go to yogafit.com and check out something that's right for you and your body and your back and your health. Save 15% at checkout by using the code MAH24. And you can find me on Instagram at Beth Shaw Health, on my website, bethshaw.com, and any social channels. Thank you so much. Please share this show. Let's make America healthy. And namaste, everyone.